How to prevent infertility after leukemia stem cell transplant. Undergoing a stem cell transplant for leukemia can be life-saving, but it also raises concerns about fertility. The good news is that there are steps you can take to help preserve your reproductive potential. The main cause of infertility after transplant is the high-dose chemotherapy and sometimes total body irradiation used during conditioning therapy before the transplant. These treatments can damage the ovaries in women and the testes in men, leading to temporary or permanent infertility. The risk increases with more intensive regimens and with age. The first step is early counseling. Patients should talk with their leukemia and transplant team as soon as possible, ideally before starting conditioning therapy. This allows for timely referral to fertility specialists and consideration of preservation options. For women, freezing eggs or embryos before treatment is the most established method. Ovarian tissue freezing is still experimental but may be an option in some cases. Using medications called gonadotropin-releasing hormone analogs during chemotherapy is being studied for ovarian protection, but it is not yet proven to be fully effective. For men, sperm banking before transplant is the standard and highly recommended. Testicular tissue freezing is still experimental. These measures aim to preserve reproductive potential before exposure to gonadotoxic therapies. When possible, choosing less intensive or reduced intensity conditioning regimens can lower the risk of infertility. These regimens are tailored to the leukemia type and treatment goals, and they may cause less damage to reproductive organs. However, in some cases, high-intensity regimens including total body irradiation are necessary, which carry a higher risk of permanent infertility. After the transplant, fertility monitoring is important. Women may experience irregular or absent periods but could still conceive. Pregnancies after transplant are considered high risk and requiring close medical supervision. Men might have reduced sperm production, but fertility can sometimes return unpredictably over time. During and after treatment, using contraception is recommended because medications and uncertain fertility recovery can pose risks to a fetus. Long-term, younger patients tend to have better chances of fertility recovery. While pregnancy after transplant is possible, it remains rare and should be managed as high risk due to potential complications like preterm birth or low birth weight. Psychological support is also vital, as infertility can impact emotional well-being and quality of life. In summary, preventing infertility after leukemia stem cell transplant involves early planning, fertility preservation options before treatment, choosing less gonadotoxic regimens when possible, and ongoing reproductive health monitoring. Patients should work closely with their healthcare team and fertility specialists to make personalized decisions based on their age, treatment plan, and reproductive goals. Always consult with your medical team for tailored advice and support on this journey.